So today we shall be starting with the attachments on the hip bone. So first of all, attachments on the ilium. If you recall your knowledge from previous lectures on the bony features of the ilium, you know that anterior superior iliac spine is the one end or the anterior limit of the iliac crest of the ilium, right? This limit of the iliac crest, which is called anterior superior iliac spine, gives attachment to lateral end of the inguinal ligament. This ligament extends from the anterior superior iliac spine till pubic tubercle, right? Next attachment that anterior superior iliac spine provides is the sartorius muscle. Sartorius muscle is one of the muscles of the anterior compartment of thigh, as well as it is the superficial most muscle of the anterior compartment of thigh. As you can see in this diagram, you can appreciate the shape of this muscle and the line of pull of this muscle. It is obliquely placed on the anterior surface of the thigh and it is strap-like. Its proximal attachment is on the anterior superior iliac spine. Also, its proximal attachment extends just above the small notch or notched area just below the anterior superior iliac spine. So sartorius also extends to some part of the upper area of this small notched depression, which is located just below the anterior superior iliac spine and just above the anterior inferior iliac spine. Now starting with the attachments on the iliac crest. Since we mentioned it in the earlier lectures when we were studying the bony features of the ilium, we know that this iliac crest is a thick ridge-like margin or the border that forms the superior limit of the ilium. It extends anteriorly from the anterior superior iliac spine till posteriorly to the posterior superior iliac spine. We also divided this iliac crest into two parts morphologically. More than anterior 2/3 is labeled as ventral segment and less than 1/3 posterior segment is labeled as the dorsal segment. In this diagram, you can see both of these segments very clearly. Now, first of all, starting with the ventral 2/3 of the iliac crest. Iliac crest is divided into at least two lips, an inner lip, an outer lip, and these two lips enclosing intermediate area, right? So attachments on the outer lip of the iliac crest include the deep fascia of the thigh, which is called fascia lata. Fascia lata is attached onto the entire length of the iliac crest. Next to it is the origin to the tensor fascia lata. You can see in this diagram. Here is the attachment or the proximal attachment of the tensor fascia lata. The name is indicating it is a muscle for the for tensing the fascia lata. And what is fascia lata? It is the deep fascia of the thigh. Next to it is the insertion of the external oblique muscle on the outer lip of the iliac crest. Ventral 2/3 of the iliac crest, its outer lip. External oblique muscle is one of the muscles for the anterior abdominal wall. Behind external oblique and the highest point of the iliac crest is the attachment for the latissimus dorsi. First year students from their previous knowledge of the upper limb know that latissimus dorsi is a muscle of the back, one of the superficial muscles of the back, and one of its attachments is on the iliac crest of the hip bone. So on the inner lip of the iliac crest, ventral 2/3 of the iliac crest, the inner lip provides attachment to the, again, an abdominal muscle called transversus abdominis. So there are three main muscles related with the anterior abdominal wall. The outermost of them is the external oblique. Next to it, deep to it, is the internal oblique, and the deepest most of them is the transversus abdominis. It gets attached on the inner lip. Then further deep to it, there is attachments on the inner lip to fascia transversalis and the fascia iliaca. Fascia transversalis, the name is indicating, is the fascia covering the transversus abdominis. So when you will peel away the flap of the transversus abdominis, we will be able to appreciate the attachment deep to it of the fascia transversalis and fascia iliaca. Fascia iliaca is a muscle of the is the fascia of the iliacus muscle, covering the iliacus muscle. Over the posterior 1/3 here, posterior 1/3 of the iliac crest gives attachment to the origin of the quadratus lumborum. Quadratus lumborum is the muscle of posterior abdominal wall, and it is also enclosed in its own fascia, as well as thoracolumbar fascia. Thoracolumbar fascia, the name is self-explanatory again, is a fascia of the thoraco-abdominal wall, and it surrounds the proximal attachment of the quadratus lumborum, which is a muscle of the posterior abdominal wall. Again, coming back to the ventral 2/3 of the iliac crest, intermediate area, the area lying between the two lips, inner and outer lip. This intermediate area provides attachment to the internal oblique muscle in its anterior 2/3. Here, over the intermediate area. Attachments on the dorsal segment of the iliac crest include, as we know from our previous knowledge again, related with the bony features of the iliac crest, we know that the dorsal segment of the iliac crest, which forms less than 1/3 of the iliac crest, is divided by a thick ridge into two areas. This is the lateral slope and this is the medial slope. The lateral slope of the dorsal segment provides attachment to the gluteus maximus. Here you can see the attachment of gluteus maximus in this diagram. The medial slope provides attachment to the erector spinae muscle. Erector spinae, again, the name is self-explanatory, is one of the muscles of the back, deepest muscles of the back, and is related with the movement of the vertebral column. Deep to its attachment, deep to the attachment of the erector spinae, almost at the level of this, near the medial border of the iliac fossa. Two ligaments get attached. Here, superiorly, on this rough area, near the medial border of the iliac fossa, provides attachment to the dorsal sacro-iliac ligament. And below it, just above this auricular area of the sacro-pelvic surface of the ilium, provides attachment to the interosseous sacro-iliac ligaments. So above is the dorsal sacro-iliac ligament and below is the interosseous sacro-iliac ligament. Both of these ligaments as the name is indicating, are related with the sacro-iliac joint, the joint formed by the sacrum, which is this bone, right? And with the sacropelvic surface, which is this one of the ilium. These two bones unite to form the sacro-iliac joint. I have another diagram to show you in order to clarify the positions or attachments of the dorsal sacroiliac ligament and interosseous ligament. So you can see this is the dorsal aspect. This is the posterior aspect of the pelvis, right? These are the outer surfaces of the ilium. Here you can see outermost from outward to within. If we move from outward to within, here is the sacrotuberous ligament. We will get to it in a bit. After peeling it off, deep to it is the dorsal sacroiliac ligament, and further deep to it is the interosseous ligament. So I hope the positions and the attachments of these two ligaments must be clear to you. Next attachments are on the anterior inferior iliac spine. Here in this diagram, again, you can see both of these diagrams. You can appreciate anterior superior iliac spine, and this is anterior inferior iliac spine. Here in this diagram, you can clearly see the origin of another muscle from the anterior compartment of thigh called rectus femoris. From the previous diagram, you can see that this is the superficial most muscle called sartorius from the anterior compartment of thigh, and when you will cut it away, you will be able to see below it is the anteriorly lying muscle from anterior compartment of thigh called rectus femoris. So here is the rectus femoris taking origin via its one head, which is labeled as straight head. That takes origin from the anterior inferior iliac spine. Below the origin of rectus femoris is attached another structure called iliofemoral ligament. It is one of the ligaments, very important ligaments related with the hip joint. So this ligament also gets attached just beneath the rough part of the just under the anterior inferior iliac spine. Here you can see the iliofemoral ligament being attached over the rough area just below the lower surface of the anterior inferior iliac spine. Posterior border of the ilium provides attachment to a ligament and a muscle. The ligament is called sacrotuberous ligament. We remember that posterior border of the ilium was extending from the posterior superior iliac spine, which was the posterior limit of the iliac crest, and it was running downward, descending down to be merged over the posterior margin of the ischial tuberosity. This posterior border of the ilium provides attachment to a ligament, a triangular shaped ligament called sacrotuberous ligament. You can see in this diagram, which is showing the dorsal aspect of the pelvis, and this is the ventral or the pelvic surface of the pelvis. This posterior aspect of the pelvis, in this you can appreciate the attachment of the triangular shaped sacrotuberous ligament. The name is indicating that this ligament arises from the sacrum and it gets attached over the tuberosity. Which tuberosity? Ischial tuberosity. Hence, the name is given to this ligament, sacrotuberous ligament. Also, you can appreciate a very important fact related to this ligament. This is a very long ligament, and it is actually converting the greater sciatic foramen, greater sciatic notch and lesser sciatic notch into two foramina. greater sciatic foramen and lesser sciatic foramen. This is the ventral aspect of the pelvis, and in this diagram, you can see the attachments of the sacrotuberous ligament. Again, converting the greater sciatic notch and lesser sciatic notch into two foramina with the help of a more transversely or obliquely placed another ligament called sacrospinous ligament. Into two foramina, greater sciatic foramen and lesser sciatic foramen. Next, posterior border of the ilium provides attachment to the piriformis muscle. Piriformis muscle arises from the ventral surface of the sacrum, passes through the greater sciatic foramen to enter the gluteal region in order to get attached over the upper end of the femur. This is the dorsal surface of the sacrum, which was giving origin to the sacrotuberous ligament, whereas the ventral surface, this is the ventral surface of the sacrum gives attachment to the piriformis. Piriformis muscle taking origin from the ventral surface passes through the greater sciatic foramen to get attached over the upper end of the femur. The gluteal surface of the ilium provides very important attachment to the gluteal muscles. The gluteal muscles include the gluteus maximus, medius, and minimus. Gluteus maximus, as you can see in this diagram, arises just behind the posterior gluteal line. We remember that the posterior gluteal line was starting to arise or was extending from at least a few centimeters behind the posterior superior iliac spine and was running downward over to the greater sciatic notch. Behind this line is the attachment for the gluteus maximus muscle. Next muscle is the gluteus medius that is attached in the area between the anterior and posterior gluteal line here. This is the anterior gluteal line, which was extending just beneath the iliac tubercle or just behind a few centimeters from the anterior superior iliac spine, right? And it was moving obliquely downward up till the upper border of the greater sciatic notch. So this area provides attachment to the gluteus medius. In this diagram, you can see this is the gluteus medius. The superficial muscle in the gluteal region is the gluteus maximus. When you will peel it away, gluteus medius will be seen lying deep to gluteus maximus. Next, deep to it is the gluteus minimus. Gluteus minimus arises from the part of the gluteal surface between the anterior and inferior gluteal line. So here is the inferior gluteal line extending from just beneath the anterior superior iliac spine, running downward again to the apex of the greater sciatic notch, just above the acetabular fossa. So this area provides attachment to the gluteus minimus. You can see in this diagram the gluteus minimus. Just beneath or under the inferior gluteal line or just above the acetabular fossa is a deep groove which provides attachment to the reflected head of the rectus femoris. Reflected head of the rectus femoris just above the acetabular fossa or under or behind or deep to the or below to the inferior gluteal line. We remember that the straight head of the rectus femoris was taking one of its attachment or was getting attached over the upper part of the anterior inferior iliac spine, and its second head, which is called the reflected head, gets attached over the deep groove just above the acetabular fossa or just below the inferior gluteal line. The capsule for the hip joint, like all the other capsules of the synovial joints, gets attached over the margins of the acetabulum here. So iliac fossa, in its most of the two-third part of the shallow depression in the iliac fossa, it gives origin to the muscle called iliacus. As you can see in this diagram, we see a muscle called psoas major along with a minor muscle called psoas minor, both arising from the posterior abdominal wall near the bodies of the lumbar vertebrae. They are also moving down. So psoas major and iliacus muscle together are called iliopsoas, and they get attached again over the upper end of the femur. The sacropelvic surface of the iliac fossa provides attachment near the iliac tuberosity. Posterior to it, we have the dorsal sacroiliac ligament. Superiorly, we have the iliolumbar ligament, and below it, we have in the greater part, we have the interosseous sacroiliac ligament. The area for the preauricular sulcus provides attachment to the ventral sacroiliac ligament. The upper part of the piriformis also gives origin to the piriformis, few fibers of the piriformis. Rest of the pelvic surface gives attachment to the, in its major part, to the obturator internus. Here in this, around this obturator foramina, most of the pelvic surface is occupied by the obturator internus in this region. So this was all about the attachments on the ilium.